Hello and welcome to the topic Autosomal Recessive Conditions in the module Clinical Genetics. Here we will be discussing conditions such as pseudoxanthoma elasticum, phenylketonuria, L-captonuria, homocystinuria, and Gaucher's disease as well as McArdle's disease. Let's get started. Pseudoxanthoma elasticum is an inherited condition, usually autosomal recessive, characterized by an abnormality in elastic fibers. Features include retinal angioid streaks, plucked chicken skin appearance, where there would be small yellow papules on the neck, antecubital fossa and axilla, cardiac involvement having mitral valve prolapse, increased risk of ischemic heart disease. Due to loss of elastic tissue, patients have an increased incidence of mitral regurgitation, aortic regurgitation, and aortic dissection. There also be evidence of gastrointestinal hemorrhage. Next, phenylketonuria. Phenylalanine is an essential amino acid. Phenylketonuria is an autosomal recessive condition caused by a disorder of phenylalanine metabolism, usually due to the defect in phenylalanine hydroxylase, an enzyme which converts phenylalanine to tyrosine. In a small number of cases, the underlying defect is a deficiency of the tetrahydrobiopterin deficient cofactor, secondary to defective dihydrobiopterin reductase. The gene for phenylalanine hydroxylase is located on chromosome 12. The incidence of phenylketonuria is around 1 in 10,000 live births. High levels of phenylalanine lead to problems such as learning difficulties and seizures. They usually present by 6 months with development delay and infantile spasms. Child classically has fair hair and blue eyes and learning difficulties with microcephaly, prominent maxilla, growth retardation, and widespread teeth are found in untreated children. Seizures typically involve infantile spasms, and there would be musty odor of urine and sweat, secondary to phenylacetate, a phenylketone. Diagnosis of classic phenylketonuria requires raised PHE enzymes, which are phenylalanine hydroxylase enzymes, levels, increased urinary phenylalanine hydroxylase enzymes, and normal cofactor concentration. The Guthrie test, which is the heel prick test done at 5 to 9 days of life, also looks for other biochemical disorders such as hypothyroidism and phenylpyruvic acid in urine. Management-wise, there's poor evidence base to suggest strict diet that prevents learning disabilities, dietary restrictions during pregnancy, as genetically normal fetuses may be affected by high maternal phenylalanine levels. L-captonuria, which is an autosomal recessive disorder of phenylalanine and tyrosine metabolism, caused by a deficiency of homogentisic acid oxidase responsible for the degradation of homogentisic acid produced from phenylalanine and tyrosine. Features are pigmented sclera, urine turns black if left exposed to the air, deposition in the joints causes cartilage pigmentation and degeneration, knees and spine is affected, renal stones are seen. Management includes high-dose vitamin C and dietary restriction of phenylalanine and tyrosine. Homocystinuria is an autosomal recessive disease caused by the deficiency of cystathionine beta synthase, which is responsible for converting homocysteine to cystathionine. Cystathionine is later converted to cysteine, so patients who have this enzyme deficiency need to supplement their diets with exogenous cysteine. There are 3 types of condition. Type 1, which has a defect in cystathionine synthetase. Type 2, there's defects in methionine tetrahydrofolate reductase. However, individuals with this condition rarely survive the neonatal period or if they survive longer than this, they often have more severe mental retardation. Among the features seen in homocystinuria, they have fine hair. Musculoskeletal-wise, they may be similar to Marfan's. Inferonasal dislocation of the lens with arterial and venous thromboembolism. The diagnosis is made by cyanide nitroprusside test, which is also positive in cystinuria. Treatment include dietary modification, which aims to reduce intake of methionine, increase cysteine, and vitamin B6 supplements. Homocystinuria versus Marfan syndrome. This table describes the differences between these two conditions, and this content is frequently tested knowledge in the exam. Gaucher's disease is an autosomal recessive mutation in gene location of chromosome 1. Both parents must be carriers for a child to be affected. If both parents are carriers, the chance of the disease is 1 in 4 or 25% with each pregnancy for an affected child. Caused by deficiency of the enzyme glucocerebrosidase, which acts on glucocerebroside. When the enzyme is defective, glucocerebroside accumulates in white blood cells, spleen, liver, kidneys, lungs, brain, and bone marrow. The types include type 1, which is called adult Gaucher's disease, seen in Ashkenazi Jewish heritage, with massive hepatosplenomegaly, bone weakness, pancytopenia, and yellowish-brown skin pigmentation. Type 2, which is infantile Gaucher's disease, also seen with hepatosplenomegaly, progressive brain damage, eye movement disorders, spasticity, and seizures. And lastly, type 3, which is juvenile Gaucher's disease. And it can occur anytime at childhood or even in adulthood, slowly progressive but milder neurologic symptoms, and they live into their early teen years and adulthood. You can investigate this disease by doing an enzyme analysis. Some lysosomal enzymes are elevated, including tartrate-resistant acid phosphatase, and hexoaminidase and chitinidase, chitotriosidase are very useful for monitoring Gaucher's disease activity in response to treatment. Other biochemical abnormalities that are seen include high ALP, angiotensin-converting enzyme, and immunoglobulin levels. Cell analysis may show crinkled paper, cytoplasm, and glycolipid-laden macrophages. As for the treatment, we require recombinant glucocerebrosidase. McArdle's disease. It is an autosomal recessive type 5 glycogen storage disease caused by myophosphorylase deficiency, which is responsible for glycogen storage in skeletal muscles. Myophosphorylase is involved in the breakdown of glycogen to glucose. The gene for myophosphorylase is on chromosome 11. This causes decreased muscle glycogenolysis. It is now known as one of the most common disorders of muscle metabolism. Features include muscle pain and stiffness following exercise, which is reversible, characterized by second wind phenomenon. After about 8 minutes, most patients achieve a second wind and can then continue exercise with less difficulty. Second wind is a phenomenon in distance running, such as marathons. An athlete who is too tired to continue suddenly finds the strength to press on top at top performance with less exertion. Other features that are seen include muscle cramps, myoglobinuria, and low lactate levels during exercise. Investigations-wise, a history of painful muscle cramps that occur within few minutes of initiating activity, which subside rapidly in conjunction with a raised serum creatinine kinase, is highly suggestive of McArdle's disease. Creatinine kinase levels are elevated in more than 90%. There is no increase in venous lactic acid levels following exercise testing, and urine study may show myoglobinuria following exercise. Muscle biopsy shows an excess of glycogen and absence of the muscle enzyme phosphorylase. In the UK, the hotspot DNA testing is done for the two most common mutations. The gold standard for the diagnosis of McArdle disease is gene sequencing. For the management, there's no specific treatment exists. Tourniquets should not be used during operative procedures, and they are advised to ingest snacks containing sucrose before exercise. We have come to the end of this topic. Thank you.